Education and mentorship is about creating a bridge between generations of surgeons. It's about taking an educational morsel, a morsel of information, and taking it from one generation to the next. And without a continuity of training, you can't get there. And that's what this is about. It's about passing those important pieces of information from one generation of surgeons to the next.
That's sort of your duty. You know, the Hippocratic Oath, one of the things is you don't keep information from other physicians. You share what you know, the good and the bad. And in fact, really, the bad is what you really want to share, because that's what tends to reduce the risk you're going to get in trouble with somebody else. And a fellowship is probably the best way to do that, because you really see challenging patients.
Anterior approach hip replacement was a novel technique for hip replacement when it was introduced in the late 90s, early 2000s under Dr. Matta. And it was an area of growing excitement in terms of innovation, of technologies. And I think the anterior approach is one of the reasons why outpatient arthroplasty has really taken off. Similarly, I see similar parallels in what's happening in the knee area with Dr. Howell.
And we knew from our early experience in ACL reconstruction, meniscal repair, and meniscal transplantation, that the knee had a certain behavior, has the kinematic axes, 3 axes about how it moves. So we decided it's important to custom position the parts and restore the patient's pre-arthritic joint lines. And so now we have a technique, we call it caliper verified kinematic alignment. And so we know that this is a 9 millimeters thick here and 8 millimeters thick here. So you'd say, well, how would you know if it went back in the right spot? You cut off what you're going to put back. So we have instrumentation that's very reliable, and we make the cut, and here we would measure the piece, and we'd say, okay, if we add in the millimeter for the saw blade thickness and cartilage wear, does it equal these pieces? And if it does, the part's in the correct position. And so when you change the thought process behind the surgical technique and the rehab, and then give the patient a better option to recover quicker and to have a more normal feeling knee when they're done, I mean, that has a big impact.
The quality of applicants these days is great. Coming out of American residencies, people are getting incredible training in joint replacement surgery, and that's to be commended. The programs across the country are fantastic. Most arthroplasty fellowships are tied to universities. You're going to get a university level experience. It's going to be typically in large hospitals, lots of support, lots of subspecialists. Here it's you, and it's how do we do this in the private practice model. And so this is really an incredible experience. It's about patient optimization, getting the patient through the outpatient environment, and how do you provide that excellence of postoperative care. This is what boots on the ground private practice is all about, and this is what you're going to go out into after your training. So why not get that kind of experience now?
And it's that type of thing, that experience, that you try to give to a fellow in a short period of time of 1 year, so they don't spend their first 5 or 10 years of their career going through what it took you to learn in your lifetime.
So when I think about the applicant who's coming out of training right now and looking at fellowships, I want them to look at what are they getting in terms of a pedigree. And it's not just the fellowship director or the particular faculty, but the lineage that faculty brings before them.
If I was a younger person saying, okay, here's somebody who knows a whole lot about a knee replacement, kinematic alignment, where do I want to spend my year? I'd sort of go find the places where they really had the experience. And I think that we offer that better than any place in the world.
I can't imagine a better pedigree than working with Dr. Howell, working with myself, working with the concepts that came from Gons, Leunig, Lode, Howell. I mean, you're coming out of the very best in hip and knee surgery. I think this is probably the best fellowship that you could want.